One of the most elusive subjects slash procedures is jaw-angled implants or gonial implants. The desire to chase perfection with the advent of social media and mounting pressure from men and women, jaw-angled implants is probably one of the least known about regarding structuring the lower half of the face. So Dr. Jonathan Zelken will demystify and educate you on jaw-angled implants. I hope you get something out of it. How you doing, Doc?
I'm doing great.
All right, so I'm going to be getting my surgery tomorrow for jaw-angled implants. So I had to search far and wide to try to find somebody credible, especially with your educational background and experience. So why is there such limited information that for this very powerful procedure? And of course, for me, I feel that it's necessary.
It's a great question. I think a lot of it has to do with fear. I think a lot of surgeons are nervous to get into this line of work because jaw angle implants are kind of the hardest implants to place dependably. And I think they are associated with higher rates of implant malposition and patient dissatisfaction in general. Because every time you have surgery, even if it's perfectly done, you're going to be swollen for 4 to 6 weeks. And the result is going to be jarring at first to the beholder. And I think with time, it gets better and better. So when you lack that instant gratification, which we surgeons get doing it on the table, you see it right away. When you lack that as a patient and you get the feedback that, it's not everything it's cracked up to be, plus higher historical rates of implant malposition or exposure or complications, plus it being a technically challenging operation that they don't train you to do in residency, I think all of these things conspire to make it in the not worth it pile for most surgeons. Fortunately, this is something I'm passionate about. I think facial sculpting is something that we keep saying as plastic surgeons we deal with the soft tissue envelope, but the bones can't be ignored either. The bones are the structure, it's the substance behind how we all look.
I've gotten a couple of surgeries and I'm trying to basically rebuild my face due to the fact that I was a combat athlete and also I suffer from sleep apnea. So my face is fading away in my opinion. So why do you feel that these older surgeons versus the newer surgeons, sometimes the older surgeons maybe are not too savvy with this surgery, or maybe they weren't trained in the aspect of this implantation technique?
I think you kind of hit the nail on the head with the latter there. I think the training is part of the problem. A lot of times when you're doing jaw angle implants in particular, and to a lesser extent cheek implants as well, the working end of the implant is right here. It's the farthest away from any incision that you can put in the face. To get to this point here that we're trying to augment, we've got to make a 2-centimeter incision on the inside of the mouth and try to get a point of an implant back and lower than the existing jaw angle. So it's kind of hard, even though it looks easy here, in real life when you've got somebody retracting the cheek open, you got to bet it's hard to get down there. You could barely get your finger down there if you tried. But we have instruments that help us elevate the soft tissues, and then to really get this working end of an implant down there in a convincing position is hard to do. So I think surgeons who are trained in either oral maxillofacial surgery or just facial trauma surgery in general, reconstruction surgery. In my case, I did a maxillofacial reconstruction fellowship. I feel really comfortable. In fact, I find this to be a very satisfying dissection. Once you lift the covering off the bone, there's very little anatomy that's more beautiful in the body. We're used to seeing blood and guts and fat from tummy tucks and things like that. But the native flat mandible is a really, really attractive thing to behold. And so not only do I find the dissection approachable, but I think that augmenting this area is something that only few surgeons can do. And if you do it well, I think, rock on. There's not as many people who are aware of this technology, so the demand's not as high. The equilibrium really does work itself out. When this becomes a very popular operation, you'll bet that all the, dental schools and everybody else are going to be training their graduates to be offering these procedures, and they will become more mainstream.
So when a potential patient comes in, obviously there's facelifting and all these other procedures. Sometimes people, they bring in a picture of, a celebrity. So when it comes to specific to jaw implantation, whose mandible comes across your desk?
That's great. I mean, I get some Timothy Chalamet,
Mm-hmm.
Everybody talks about Angelina Jolie, and this brings up an interesting point. The male and female ideal shapes for a jawline are actually the same shape. It's the size that's different. But that sort of curvilinear shadow from the ear going down to the chin, that's one uninterrupted shadow that's got mostly sort of a straight component and then a curved component posteriorly is really what we go for. I get everybody's name. You presented a few names to me today in our discussion. It's really truly what you find attractive. And you need to find a surgeon that knows not only what's objectively attractive, but how to achieve your goals. Because not everybody's goals are the same. One thing I'm seeing a lot of are the wraparound implants. They have to be thick enough at every single point to be an on-block, monoblock implant. And so what I'm seeing a lot of complaints about are that when you get this wraparound jaw implant, for example, it's too thick right here where the mandible naturally bows out. So you got to find a surgeon who's willing to say no to norms and find something that works for you. I'm not sure if this is exactly answering your question, but the truth is I'm not a pop culture guru. And other than Timothy Chalamet and a few other names, Angelina Jolie, when somebody says what jaw, somebody shows me a picture, I can recognize an attractive jawline, but I don't know who it is. So, so those are the names that I hear. I mean, if you mention a few names, I'm going to quickly nod and say, yes, that's what people want as well. Obviously Brad Pitt, Tom Brady.
So when it comes to jaw angled implants, one of the complaints, and everything has a complication profile. So let's say we put the implants in and one of the ill effects could be that they get infected and then they have to be, taken out. So now a patient comes in, they paid X amount of dollars for the surgery plus the facility. So if we have to let the infection calm down and then go back in because these implants were paid for, they were handcrafted for the patient, how much would it cost to reinsert these implants?
It's a very good question. Unfortunately, there are very few cases that I can think of to give you examples, but it definitely can happen. I've had it happen in one chin, and I've had it happen under one tear trough implant in my career, which is a very low percentage, but it's not zero. And what happens is usually it's a little bit of a conundrum. I mean, what we do as surgeons is do our best to put you in a position where this will not happen. For example, we're operating with incisions inside the mouth, which is the dirtiest part of the human form. And we're trying to put an implant in there. I mean, you're looking at hip implants going in basically like negative pressure rooms with entire gowns and hoods and things like that. Meanwhile, we're making cuts inside the mouth next to plaque, even though we try our hardest to get that clean in the prep process. It can happen, especially with jaw angle implants. It can happen. And really what we do is this. If that happens, the implants come out and you got to get new implants. That's number one. I'm not going to reuse implants and you're going to be responsible for the cost. Number two, if it's something I can do in the office under local anesthesia, like a tear trough or something like that, I'll do that. I'll take out the implant and it's usually no charge to the patient to do that. If you have to go to the OR, for example, there's going to be OR and anesthesia fees associated with it. But generally, those operations take 45 minutes to an hour and it's not a huge encumbrance. When the implants go back in, there's going to be a reduced fee, but it's not a non-zero fee for surgeons' fees. Otherwise, we do everything we can to prevent infections from occurring, but when they do occur, if it's out of our control, there's only so much we can do.
Okay.
Financially to assist.
No, I appreciate your honesty.
Yeah, fortunately it doesn't happen often, but when it does, I think having a policy in place does eliminate a lot of that confusion.
Awesome. When it comes to jaw implants, what would you say the healing process for the normal human being is? From, one day post-op to, whenever. When could someone say regarding swelling and micro swelling that this is the end result? Because, I've had multiple surgeries, as you know, and I'm a good patient. I understand that there is downtime. And to be honest, people are unreasonable. They expect a surgeon to go in and then they want to be, running a marathon 3 days later. So if we had to specify or hone in on the genre of jaw implantation, what's the healing timeline?
So that's a really good question, and I think it's different for everybody. I've done videos on this topic for facelifts and fat pad removal, but not facial implants, and I think I'm really grateful to you for asking this question. The answer is, there is no answer, but I know that's not satisfactory, so I'm going to say a year. Because the truth is, it's a curve of swelling. Initially, the swelling goes down pretty quickly. At 2 weeks, you look passable. Okay? Even though you may perceive yourself as looking terrifying, to the outside observer, you look passable. I had buccal fat pad removal 2 weeks ago, and it was with a ton of local anesthesia, and everybody else says I look normal, but I still see that I have jowls and swelling. So what you perceive and what others perceive are going to be different. After 2 to 4 weeks, you look passable, okay? Once you get to that 6-month point, that's what plastic surgeons will classically say, okay, you're discharged from my practice, you're healed, congratulations, carry on. Anything else you want to do in the future, let me know. What I've noticed in facial surgery, though, is that result continues to evolve for a year. It's a slower, steadier improvement, and you don't see it when you glance at a patient for the first time in 6 months. But if you look at like serial clinical photographs, you will see that the result in some patients continues to evolve through a year. After a year or so, I think you're done.